Continuing with the Roshini series on laziness and procrastination, I want to discuss the medical reasons of why a child or an adult is often labeled or branded as lazy. Now let us look at an anxious child, a child who gets worried about small things. It is very much possible that this child is afraid about the results of the exam. It may be because parents will scold, or he or she may be coming first, they're afraid they may not be able to do this time, or they're afraid they'll fail the exam, and so on and so forth. An anxious mind just needs reasons. So when you are studying for the exam, but you're afraid of the result, what would you do? You would rather postpone it, nay? You want to postpone your anxiety to the next day. I don't want to face that fear of what if I don't do well enough. So that is one major reason why people are often called lazy. So anxiety is the reason. Just let's extrapolate it to an adult who is about to give a presentation or is going to complete a project. He's so afraid of making those mistakes that he will push that work till the last minute. And when the pressure is tremendous and he has no other option, that is the time he will sit to work. Therefore, these are also called or branded as lazy. So this is the first category of anxious people. The second category are those who have inattention. They suffer from a condition called ADHD, Attention Deficit Hyperactivity Disorder. Consider a child having ADHD. Parents often come to us saying, "Ma'am, my child is so lazy. I have difficulty waking him or her up from the bed. They take such a long time just brushing their teeth. They will look into the mirror and seem to be lost in the world. I have to keep shouting outside the bathroom door to get them to have a bath. They again tie the shoelaces and slowly dream, and it seemed to be in a dream world. They're very disorganized in their work. My child is very lazy, ma'am." Here, the laziness may be stemming from the inability to organize their daily tasks. So, inattention or ability not able to focus on the task and drifting off is a hallmark feature of ADHD, both in children as well as in adults, and therefore they are also branded as lazy. The third point, you find somebody who's very sad, who's unhappy, who does not like anything anymore. These are depressed people. Depression also can be wrongly branded as laziness. How? In depression, the networks in the brain which are responsible for our feeling pleasure are down. Let's take an example. You love ice cream, chocolate ice cream to be specific. And whenever you get it, you get that aha feeling, I loved it. But when you're depressed and this network is not working, even when you're tasting the ice cream, it feels bland. Oh, I don't want it. Similarly, a student who really loves to study and do well in exams and gets a kick of being saying, "Oh, you're such a good student," and being praised by the teachers, now feels very indifferent. "Oh, I can't even get up from the bed, leave alone studying." These people are also wrongly labeled as lazy. So laziness is a characteristic which is often found across disorders in mental health. I'm talking only of mental health. There can be various physical reasons for being lazy, but that's outside the topic. So before you blame a child or brand a child as lazy, you blame or brand an adult as lazy, sometimes you have to look at the medical conditions as well. And as I enumerated, the three most common conditions who walk into our OPD after receiving a label of lazy are often anxiety disorders, depressive disorders, and ADHD. There can be many more, but these are the few things that we often look for. So before you brand, please find out what's the cause.